Important chapter because the presence of bundle branch block definitely most often indicates the disease. 95% of times indicates the disease, and there is some problem in the myocardium or in the conduction system. So many etiologies for bundle branch block: congenital heart disease, rheumatic heart disease, coronary heart disease, aging, everything can produce conduction system disease. So a very important chapter, QRS widening. So we all know, we are all experts now about the ventricular process of depolarization. We know how it happens. So I think 3 or 4 times I told you. And most important thing to remember is normal QRS duration is 0.08 seconds. Why it is 0.08 seconds? Because entire ventricular myocardium is depolarized by specialized conduction system which is conducting at the speed of 4000 millimeters per second. So this you have to understand. This you have to be very clear before we understand a bundle branch block. Why it is 0.08 second? Because every portion of the heart should be depolarized by the specialized conduction system. So when it's not happening, you will have a white QRS. Right. So this is your normal ECG having a QRS duration of less than 0.08 second. Once you decide it is a QRS widening, then you have to see carefully whether the QRS widening is due to the initial portion of the QRS complex or the terminal portion of the QRS complex. The QRS can widen. It may be due to the terminal delay or due to the initial delay. Some QRS is widening because the initial portion of the QRS is widened. Whereas some cases it may be the terminal delay. Whenever there is an initial delay QRS widening, we must suspect a pre-excitation syndrome like Wolff-Parkinson-White syndrome. Whereas whenever the QRS is widened because of the terminal portion of the QRS which is getting delayed, you must suspect a bundle branch block, either right bundle branch block or a left bundle branch block. So the first step is to diagnose a QRS widening. Second step is to see whether it is initial delay or a terminal delay. If it is initial delay, pre-excitation, terminal delay, it is a bundle branch block. So look at this ECG here. The QRS is widened, isn't it? It's around 4 squares. QRS is 4 squares here. But see that initial portion, it is little short. Terminal portion is, you see, so much sharp and narrow. So here the QRS is widened because of the initial delay in the QRS, and it is also associated with what? Short PR there. See the PR? P wave is sitting on the QRS. There is no PR segment at all. That means what? Your AV node is bypassed, and the bypassed pathway is depolarizing the ventricular myocardium aberrantly, which produces the initial delay in the QRS. So this is a classical initial delay in the QRS, which is a WPW or a pre-excitation syndrome. Whereas if the QR can see that here, you can see that initial portion of the QRS which is so narrow. See that initial sharp R wave, or see it here in V5, V6, the initial R wave is so sharp, but you see the terminal portion of the QRS is wide. Terminal portion of the QRS is wide. So initial portion is normal, but here the QRS complex is widened because of the terminal delay in the QRS complex. Then you must suspect a bundle branch block. So in both situations, one portion of the myocardium is not depolarized by specialized conduction system. Both in bundle branch block and in pre-excitation, a portion is not depolarized by the specialized conduction system. That's why it's get widened. In WPW syndrome, it is the initial portion of the ventricular depolarization which is aberrant. The initial portion of the ventricular depolarization is not done by specialized conduction system. That's why you have an initial delay. Whereas in a bundle branch block, it is the terminal portion of the depolarization is not done by specialized conduction system. That's why the terminal portion of QRS is widened. So this is a concept you must understand. So luckily we have only 2 bundle branches. So you have to understand only 2 bundle branch blocks, right bundle branch block and left bundle branch block. So say in a right bundle branch block, let us see what happens. In right bundle branch block, what is the first area to be activated? It is the septum, isn't it? Septum is activated by which bundle? Left bundle. Here the left bundle is intact. We are going to talk about the right bundle branch block. Here the right bundle is going to be blocked. My left bundle is intact. That means my septal activation which is going to occur from left to right is continued to occur normally. So the septal activation is not altered. So my septal activation is continued to occur from left to right, which will result in a small R wave in V1 and a small Q wave in V5, V6 as normally. Septal activation is not altered because left bundle is intact. Now the impulse here will not go through the right bundle to activate the right ventricle here. It will go through the left bundle and first activate the left ventricle here. So the vector number 2 will be activating the left ventricle, resulting in a positive wave in V5, V6 and resulting in a negative wave in V1. So this is a vector number 2, which is a normal left ventricular activation by this time. But normally at this point in time, your right ventricle also should be activated simultaneously in a normal situation. But here, because the right bundle is blocked, when the left ventricle is getting activated, your right ventricle is not activated at this moment. Right ventricle is not depolarized yet. So for the right ventricular depolarization, the impulse has to travel through the muscle from the left ventricle towards the right ventricle and then depolarize the right ventricle there. So this is a vector number 3. Normally we have only 2 vectors, subtle vector, then simultaneous left and right ventricular activation vector. Dominant left vector V5, V6 positive. That's what normally you have. Here what happens is, vector number 1 is happening normally, 2 is happening normally, but the third vector which is coming through the muscle is the one which produces the widening of the QRS now. See it here, it is a terminal portion of your ventricular depolarization which is happening through the muscle. That's why your terminal portion of the QRS is widened. But this vector, the third vector, is coming towards the right side, towards the right ventricle. Isn't it? The last vector is coming towards the right ventricle. So in a right bundle branch block, the right ventricle is the last portion to be activated. That means the last vector is going to come towards the right side. And this vector is traveling through the muscle. Because of that, you get terminal delayed slurred positivity over the right sided lead. So vector number 3, it's widened and delayed and it is coming towards the right, producing the terminal delayed slurred positivity in V1 and terminal delayed slurred negativity in V5 and V6. So the third vector is coming towards the right. So I don't want you to say what is right bundle branch block, M pattern in V1. What is left bundle branch block, M pattern in V5, V6. So this is the things we should not say. When we say right bundle branch block, the concept is right ventricle gets activated late, it is activated through the muscle. So my last vector is going to come towards the right side. That means I have a terminal R wave in V1. But this terminal R wave is going to come slowly, it gets widened. So I get a terminal delayed slurred positivity in V1. It is a right bundle branch block. Because this vector is coming towards right, my left sided leads will have a terminal delayed slurred negativity in V5, V6. So this is a right bundle branch block. Here the depolarization is delayed or normal? RBB depolarization is delayed or normal? Delayed. So what will happen to your STT changes? Just like it happened in ventricular hypertrophy. In the ventricular hypertrophy it delayed because the muscle was bigger. Here it is getting delayed because the bundle is blocked. So anyway the depolarization is delayed. So whenever the depolarization is delayed, what will happen to the repolarization? It will happen in the same direction, resulting in the opposite secondary STT changes, opposite to the terminal portion. So QRS is upright here, the ST segment, the T wave is negative, downsloping ST segment and T wave will also happen in bundle branch block. Here also the depolarization is delayed because the depolarization is coming through the muscle. So you will continue to have secondary STT changes, just like we had high pressure overload on the left ventricular hypertrophy or right ventricular hypertrophy. You will have a secondary STT changes opposite to the terminal portion of QRS. So this is your right bundle branch block. So look at this CCG here first. First important thing is to first identify QRS widening. QRS is widened. Second step is to identify this QRS widening is due to terminal delay. Right. Then we must see where is the terminal vector coming. If the terminal vector is coming towards the right side, it is a right bundle branch block. So you see it here in V1, the terminal vector is delayed, slurred and it is positive. So whenever the QRS is widening and there is a terminal delayed slurred positivity in V1, it is right bundle branch block. Terminal delayed slurred negativity in V5, V6, it is right bundle branch block. So because the depolarization is delayed, you have secondary STT changes producing ST segment and T wave. The concept is wherever the bundle is blocked to a particular ventricle, that particular ventricle is activated last and it is activated through the muscle. So the last vector will come towards that particular ventricle for which the bundle is blocked. If the right bundle is blocked, the last vector will come towards the right side. That is the last ventricle to be activated and it will come through the muscle. So this results in a terminal delayed positivity over V1, negativity in V5, V6, secondary STT changes. So what is the criteria to diagnose right bundle branch block? QRS widening, terminal delay. Terminal delayed slurred positivity over right sided leads terminal delayed slurred negativity of left sided leads. Septal activation is not altered. Please remember that. Because my intact left bundle is continue to activate my septum from left to right. So it is not altered. Secondary STT changes are there. Not all right bundle branch block are diseases. You can have a right bundle branch block in 5% of normal population. So not always the right bundle branch block is disease. So this is your right bundle branch block. You can see that here in V1 the QRS is widened. My QRS is widened, but the terminal delayed slurred positivity is happening right sided leads, no right bundle branch block. This will result in terminal delayed slurred negativity because this terminal vector, the slurred vector is going towards the right side, away from my left side. So this will have slurred negativity, and here you have that slurred positivity. So this is a classical right bundle branch block. So 5% of normal situation or normal people can have right bundle branch block. So whenever they say right bundle branch block, don't say W or M. It is terminal delayed slurred positivity over right sided leads and negativity over the left sided leads. So now we look at the left bundle branch block. Left bundle branch block is little more difficult because it is going to alter the depolarization process right from the beginning. Whereas in a right bundle branch block, only the terminal portion was altered. Whereas in left bundle branch block, even the first portion is going to be altered. Why? No longer your septum is going to be depolarized from left to right because the left bundle is blocked now. My left bundle is blocked now. So my septum has to be depolarized from right bundle from right to left. That means you will not have the septal Q wave in V5, V6 in left bundle branch block. You will never have a septal Q wave in V5, V6 in left bundle branch block because that septal vector now is going to come towards the left side and away from my right side. So this will result in opposite septal activation. So my septal activation now is happening from the right side towards the left side. So no longer I have the septal activation. Then after this, the intact right bundle will activate the right ventricle, which is vector number 2, which will produce a very small R wave or minimal slur in the QRS complex there. Here there may be a small S wave there. But because the right ventricle is very weak structure, it may not produce a significant impact of an R wave here. So this is a septal vector number, this is a right ventricle depolarization vector. Now what will happen to the left ventricle now? The left ventricle has to be activated through the muscle from the right ventricle towards the left ventricle. So what is the last vector in left bundle branch block? In which direction it is going to come? Louder. It is going to come towards left side. So now you can see that the last vector which is coming through the muscle is going to come towards the left side. So you'll have a terminal delayed slurred positivity over the left sided leads in left bundle branch block. You will not have any Q wave there because the septal activation is altered. It is very difficult to diagnose an anterwall infarction in the presence of left bundle branch block because all your activation is altered. So it is difficult to diagnose anterwall infarction in the presence of left bundle branch block. It is easy to diagnose anterwall infarction right bundle branch block because the activation is not altered in the initial activation is not altered in right bundle branch block. So what is happening to the left bundle branch block? Terminal delayed slurred positivity over left sided leads. It is a left bundle branch block. Terminal delayed slurred positivity. The concept to understand is whichever the ventricle for which the bundle is blocked is going to be activated through the muscle, and this is going to be activated last. If it is a right bundle branch block, right ventricle is the last ventricle to be activated, and for this the impulse has to come through the muscle. This will widen the QRS, and this portion of the QRS will have a widened QRS slurred positivity. Similarly on the left side. So look at this CCG now. Now the first thing to diagnose is what? QRS widening. So see that initial portion there. Initial portion is so sharp there. So it is widening is due to the terminal delay. So it is a bundle branch block. So once you decide bundle branch block, T the positivity, slurred positivity, where the slurred positivity is. Is it in V1? No. Is it in V5, V6? Yes. So what bundle branch block this is? It is written very nicely there. So what bundle branch block this is? Left bundle branch block. Similarly for this you can see that here. You can see that here. Where was the terminal positivity? In right sided lead. So it's a right bundle branch. It's so easy to diagnose, provided you understand the concepts how the impulses are going in left bundle branch block. So what is this? The T wave change. See, the change is secondary T wave change, because for the left ventricle the depolarization is delayed. So the repolarization starts in the same direction, resulting in downsloping ST segment and T wave, which is a secondary STT change. So the criteria to diagnose left bundle branch block is QRS widening, terminal delay, terminal delayed slurred positivity over the left sided leads, terminal delayed slurred negativity over the right sided leads. Septal activation is altered. It is happening from right to left in left bundle branch block. So you will not have initial Q wave in uncomplicated left bundle branch block. In any left bundle branch block, you will not have that septal Q wave which you used to describe normally in our normal ventricular depolarization. And secondary STT changes are there because the depolarization is delayed. Left bundle branch block is always almost abnormal. So when you have a left bundle branch block, you have disease. You have either the vascular disease, whether you have a myocardial disease, or you have a conduction system disease, anything, but you have a disease when you have a left bundle branch block. So left bundle branch block is almost always abnormal. So this is your QRS widening due to terminal delay. So this is the ECG here. You can see it here. It is a widening of the QRS. You look at the V1, you look at the V5, V6. The V5, V6 is going to show you terminal delayed slurred positivity on the left sided leads, STT changes, and important thing is you have no septal Q wave because septal activation is right to left in left bundle branch block. It is completely altered in left bundle branch block. So this is the difference between the left bundle branch block and the right bundle branch block. So having diagnosed the left bundle branch block, you know it is a disease. Then you have to look for conditions like coronary heart disease, valvular disease, or left ventricular hypertrophy, or cardiomyopathy, or a conduction system disease. So now, as far as the left bundle branch block is concerned, I told you the criteria to look at the chest leads only. For bundle branch block, which leads you have looked at? You looked at only the chest leads. You looked at V1, you looked at the V5, V6. For axis deviation, you looked at only limb leads. For bundle branch block, you looked at only the chest leads. But by looking at the limb leads, also you can diagnose bundle branch block. This is once again to impress others and also to intimidate others. For example, as the ECG is being recorded, thus the lead 1 has come out, no other lead has come out, only lead 1 has come out from the ECG machine. You look at and say right bundle branch block. You look at and say it's a left bundle branch block. No other lead is recorded. Only lead 1 has come out of the ECG machine, and seeing lead 1 itself, we are saying, oh, this is a right bundle branch block. Oh, people will be astonished and amazed by your ECG knowledge. So I will give you a trick how to diagnose the bundle branch block by looking at only one limb lead. By looking at only one lead, that is lead 1, that is the first lead you are going to record. Right? This is a trick. You must not tell any others. Only people attending this workshop are entitled for this secret. No? So you should not tell others. Right? You must see that. Please remember, my V5, V6 is here. My L1 is just above. My L1 is a horizontal lead. My V5, V6 is also here. So V5, V6 and L1 are closely related to one another. They are very proximal leads. So majority of your ECGs, V5, V6, the QRS complex is almost similar to L1. Isn't it? It's very logic, isn't it? Your L1 is here, V5, V6 is here. So my V1, V6 majority of times will resemble my L1. So L1 will be almost like V5, V6 in majority of normal ECGs. So I utilize this important information to diagnose. So V5, V6 is the one I can diagnose right bundle branch block or left bundle branch block by looking at V5, V6, isn't it? If my V5, V6 shows terminal delayed slurred positivity, what is my diagnosis? LBB. If my L1 shows delayed terminal negativity, what is my diagnosis? RBB. So the V5, V6 is going to look like L1. So if I look at L1, I am looking at V5, V6. It is just like I am looking at V5, V6. So my L1 has got terminal delayed slurred positivity. What is my diagnosis? If L1 says got terminal delayed slurred positivity, means V5, V6 also will have a terminal delayed slurred positivity. What is my diagnosis? LBB. If my L1 shows a terminal delayed slurred negativity, what is my diagnosis? RBB, that's all. So when you look at L1, whether it is a terminal positivity in L1, LBB, terminal negativity in L1, right bundle branch block. So even without looking at the chest leads, as the ECG is coming out of L1, you can diagnose whether it is a right bundle branch block or left bundle branch block, right? Look at here, this is lead V5, V6, you can see that here. Look at the lead V1. In both situations, you have what? Terminal delayed, slurred, negative. This is a right bundle branch block because my L1 has got delayed, slurred, terminal negativity. That means terminal vector is going away from my L1. L1 is a horizontal and left sided lead. Because it is going away, terminal vector is going towards the right side. It has to be a right bundle branch block, isn't it? So this is a slurred S wave. If you have the slurred S wave in L1, it is the right bundle branch block. Slurred S wave in L1. Whereas you look at this ECG. Here you see that V5, V6, you look at the L1. You look at this exactly the similar QRS complexes in V6 and L1. Almost similar. So here is QRS widening. Terminal component is what? Positive or negative here? Positive. So what bundle branch block this is? Left bundle branch block. So just like looking at L1, it is possible to say whether it is a right bundle branch block or left bundle branch block. Because L1 is going to mimic V5, V6. Left sided leads will tell you whether the terminal vector is coming towards left or going towards right. So V5, V6 is going to tell you what vector it is going. So it is looking at L1 itself, we are going to say whether it is a left bundle branch block or a right bundle branch block. So this is left bundle branch block criteria. So now look at the ECG. What bundle branch block this is? Right? RBB or LBB? Why RBB? Slurred negativity. What is it? Chest leads. What is it? RBB. So you are confirming with a looking at L1. So looking at L1 here, you think it's an RBB. In chest leads, it is right bundle branch block. So it's a classical right bundle branch block. So what is it? So we can say L1, terminal delayed slurred, positivity is there. So this is, we can see in this chest leads, it is left bundle branch block. V1 is negative, V5, V6 terminal delayed positivity. So L1 itself will give you a clue whether it is a right bundle branch block or a left bundle branch block. So just look at L1. So as it is being recorded, without looking at the chest leads, if you say it is a bundle branch block of right or left, people are definitely, you think you say ECG pista and so on. So you'll have a definite approach to you whenever they see you, they see you a lot of admiration and lot of. So it also can be a complete right bundle branch block or an incomplete right bundle branch block, depends upon the QRS widening. If the QRS is just widened, just 3 squares, it is called incomplete bundle branch block. The QRS is widened more than 3 squares, it is complete bundle branch block. So incomplete or complete depends upon the QRS width and duration. So this is your summary of bundle branch block. So in bundle branch block, first thing is QRS widening more than 0.08 second. Once it is widened, look whether it is due to the initial delay or a terminal delay. If it is initial delay, it is WPW or a pre-excitation syndrome. If it is a terminal delay, it is bundle branch block. Once you decide it is a terminal delay and bundle branch block, thing to be seen is a terminal delayed slurred positivity in which group of leads. If the terminal delayed slurred positivity is over the right sided leads, it is right bundle branch block. 5% of normal people can have it. The concept is the right ventricle is the last one to be activated and it is activated through the muscle. Last vector is coming towards the right side. Whereas the terminal delayed slurred positivity is over the left sided leads, it is left bundle branch block. The concept is the left ventricle is to be activated late. This activation front is coming from the right ventricle through the muscle. So the left sided lead will have a terminal delayed slurred positivity. Almost always pathological. Left bundle branch block is almost always pathological. Of course, looking the QRS width of more than 0.08 but less than 0.12, it can be an incomplete bundle branch block. More than 0.12, it can be a complete bundle branch block. Whereas looking at L1 itself, it is easy to understand and diagnose a bundle branch block. L1 shows the terminal delayed slurred negativity, it is right bundle branch block. L1 shows terminal delayed slurred positivity, it is the left bundle branch block. So this is looking at the L1 itself, you can diagnose a bundle branch block. So the QRS widening can happen due to so many other situations also. It's not only bundle branch block, not only WPW syndrome. It can happen, as I told you, many drugs can induce a left bundle branch block or a QRS widening. So the drugs which can produce an abnormality of the action potential of the initial upstroke, the sodium entry. Because as I told you, action potential, the upstroke corresponds to your QRS. So whatever the abnormalities which is happening in the upstroke of sodium entry can widen the QRS. Even though you do not have a bundle branch block, because of the abnormal entry of sodium which can happen, which can widen your QRS complex. The important drugs which can widen QRS complex are tricyclic antidepressants. The tricyclic antidepressants, especially the toxicity of tricyclic antidepressants, most often suspected by looking at the QRS widening. Due to ECG in QRS widening, if the QRS gets prolonged, you know there is a significant tricyclic antidepressant toxicity. Right?